Good morning, everyone. My name is Shanna Rivera, and I'm so happy to be here at the 4th Annual Functional Medicine Symposium. Today, I'm going to present to you on breast and full body thermography. I own Flowell. Flowell is my business, and I operate out of a few different states here in the US. So I'm going to introduce you to our Flowell team. This is me, Shanna Rivera. I'm a certified thermographic technician, and I'm also an IBDS, an independent Beamer distributor senior. And I founded Flowell back in 2016, and I'm proud to be a professional member of PACT. They're the Professional Academy of Clinical Thermology and also of Breast Thermography International. This is Janelle Solomon. She services our patients in South Carolina and also Northern Florida. We also have Jenna Slade. She works down in South Florida and also West Florida in the Tampa and Sarasota areas. This is Isobelle. She keeps us all in line. So if you decide to get a thermography scan, she'll probably give you a call and remind you about your appointment. We have many locations at Flowell, so we're going to dive into what medical thermography is all about in just a minute, but we do have a very generous referral program. So I wanted to make sure everybody watching here saw all of our locations in case you have a friend or a family member to refer in any areas that we currently image at. We're in California, Georgia, Florida, South Carolina, and Washington. We also have new locations that are available upon request. So I'm going to fly through some of these, but these are just to give you an idea of all the cities that we service in all of these states here. We are traveling technicians, and we like to be able to come to an area near you. One of the ways that I actually got connected with this symposium is through Dr. JP Salibi, and he owns Carolina Holistic Medicine in Murrells Inlet and also in Mount Pleasant. And I'm very grateful to be here with you all today. So what I want to explain to you today is what makes medical thermography so popular. So it's most well known for breast thermography, and I'm going to tell you some stats right now on why it's most well known for breast thermography. So in the US today, 1 in 8 women develop breast cancer. Currently, there's 280,000 new cases of invasive breast cancer diagnosed every single year. There's over 40,000 deaths each year from breast cancer for both men and women. It's not just women that can get breast cancer. 80% have no family history. 80%, that's huge. That means everybody should be getting this safe, valuable screening tool. It's predicted that in 2030, that the stats are going to go up to 440,000 new cases every single year. And then the stats for men, it's 1 in 833 men are diagnosed annually with breast cancer. To give you a brief history on thermography, I want to get into some case studies here so you guys can really see what it's all about. So I'm not going to harp on this too much, but one of the biggest ones, everyone always says, how long has thermography been around? And it's kind of been around since 400 BC here, when Hippocrates, he first used clay on the body. He wanted to see where the clay would dry first. And that indicated it could be an area of inflammation in the body, or it could be a pathology. You know, there could be a cancer forming in that area. And then we jump up to 1960, where the infrared camera became popular, and so shortly thereafter, they started using it for breast cancer detection. It was actually approved by, let's see, the FDA cleared thermography as an adjunctive screening in 1982, for breast cancer screening, thyroid pathology, cerebrovascular screening, where you check the carotid arteries, and much more. So what exactly is cancer? Cancer is the uncontrolled proliferation of cells in your body. We all have cancer cells in our body, but normally our immune system is able to keep those in check for you. Cancer, it doubles on average every 90 days if it is able to grow and form a tumor in the body. And if that happens, it goes through this process called angioneogenesis, where the precancerous cells traveling in the body are able to latch onto a blood supply and feed from the nutrients from our blood, or even toxins from the body, and they grow and they double on average every 90 days. Cancer's preferred food is sugar, so it is good to eat a sugar-free diet, an anti-inflammatory diet as well. So when these tumors are able to form in the body and they're growing from a blood supply, and our blood is hot. So that's how you can identify if something in the body may be cancerous. If there's an area of the body that has too much heat, you would be told to go for further testing to confirm or deny what the thermography is showing. Sure, many of you are familiar with mammogram. There's also ultrasound, totally safe for the body, use sound wave imaging. There's MRIs, magnetic imaging, if you can have it with or without contrast. And then there's thermography, the high resolution infrared photographs that you get of the heat signatures of your body. Here was a study that was done at Harvard. I'm sure most of you have heard of Harvard in Massachusetts, where it actually concluded that between 15 and 25% of breast cancer cases are currently overdiagnosed. That means that between 15 and 25% of breast cancer cases are incorrectly being diagnosed with cancer, and these women or men are getting lumpectomies, mastectomies, and cancer treatment like chemotherapy and radiation. So with mammograms, they emit ionizing radiation. They can be painful. 80% of biopsies that are taken based on a mammogram come back negative. 20% come back as a false negative, meaning 20% are missed in mammography. And mammogram guidelines are currently being challenged at this time. They're saying it's too much radiation for women under 40, and should they bump it up to 50? And they've actually made that recommendation up in Canada. With the thermography screening, we can check the thyroid. It's good for breast cancer detection. As I mentioned before, the carotid arteries. You can see signs of hormonal imbalance in the body through mottling patterns. It kind of looks like leopard spots on your body in the thermography images. That also could indicate toxic buildup in the body. We do an excellent spine analysis for you to analyze your gait and your posture. There's vein analysis of the body, and also we look for any nerve pathology. All right, so thermography screenings detect the physiology of the body instead of the anatomy. We're looking for heat signatures with thermography versus those anatomical tests that I mentioned. They're looking for a physical tumor that's already big enough to be seen on an anatomical study. So thermographies can detect cancer cells that are not yet dense enough to show up on an X-ray, which that's what a mammogram is, or other anatomical tests. There's no compression with thermography. So if you compress the breast tissue and there were cancer present, you run the risk of spreading that. There's no radiation, and it is safe at any age. For years, my youngest patient was 2, and my oldest 96, but now my youngest is actually my son. He's 6 months old, and we scanned him at 2 months old. And thank goodness he came up thermographically normal. All right, so here are some case studies coming up. We gathered a variety of case studies for you because we wanted you to see a range from normal thermography images to extreme cases of cancer and other diseases. So these slides will be presented for educational purposes today. Here are 3 of the images that we take for the breast series. We actually take 6 for the breast series. On the left here, we have the left oblique shot, then we have the anterior shot of the front of the breast, and then the right oblique shot. So what we look for from the right to the left side of the body are the differences in temperatures. And our interpreting doctors, our PACT thermologists, have come up with normal to abnormal limits, and many thermologists throughout the world adhere to those standards as well. And if you have any abnormal findings, our interpreting doctors are going to recommend at least a 6-month follow-up for you. It's extremely common for adults to have a 6-month follow-up because most of us, we don't take care of our bodies as we're meant to 100% of the time. If there are some more significant findings, I've seen follow-up recommended in 3 months and also 1 month. And for thermography, that's what they recommend for the follow-ups. And then typically, if there are findings, they'll recommend comparative anatomical testing, and always consult with your doctor about your thermography results. If everything looks all good, or if someone comes back for their 6-month follow-up, quite often they get a year recommendation to come back in 1 year. And as thermographers, that's what we love to see, because that tells us that things are either stable, so nothing has increased in temperature that was questionable, or things have improved, which is what I love. I love to see that when I go over these reports with patients. So these next 3 slides are images from the same patient. And here we see rainbow palette, where we can best see heat and color. And the following 2 slides are going to show you the inverse grayscale palettes to best see vascularity throughout the body. This patient has a delta T abnormal finding of 1.99 degrees Celsius, 2.95, 3.33, and also a global temperature finding of 1.19. So all those numbers I just mentioned before, the threshold's 2 degrees Celsius. So that's definitely something we're gonna want her to come back in at least 6 months and follow up thermographically, get some anatomical testing, and really figure out what is all this red in the left breast that we see, both above the nipple and also in the inside, the upper inner quadrant of the front of her breast. And then the global temperature, when you're going to see some really big circles drawn on your breast for the global temperature. And the threshold there from the right to the left side of the body is 0.3 degrees Celsius. And this patient had a finding of 1.19. So that's significantly higher than 0.3 and definitely not something to ignore. She would want to investigate this further. Basically, we want to rule out that it is not cancer forming in the body. And if that's the case, that's wonderful. We hope that's the case. And then she'll have time to detox or balance out her hormones or figure out what else could have caused that heat signature that she might be able to address before she could have it fester for years and decades, and then eventually cancer could form in the body. Here are those inverse grayscale images that I told you about. And they actually took the temperature findings not where I would have thought they would, but they saw on, let's see, this image here on the left, pointing at the camera is her left breast. And then this one on the image on the right, pointing at the camera, is her right breast. And so you can see underneath these red circles, the one on her right breast right here, hopefully you can see my mouse, there's hardly any vascular pattern under that. And then over here, there's a vascular pattern where there's not one on the opposite side. So we're symmetric, so our interpreting doctors want to see from one point to the other, what is the difference in temperature in Celsius? And for those 2 circles, the difference in temperature was 2.74. So that's too much heat. And if the threshold's 2 degrees Celsius, if you remember from before, and that's going to be one of the contributing factors that we want her to go follow up in 6 months, maybe get some anatomical testing and talk to her doctor. And there's 2 things going on. This circle is unusually cold, and then this one is a little bit hot. So that's part of the reason why it's causing that difference in temperature, the 2.74, but better safe than sorry. We're going to have her talk to her doctor and get some further testing. This is the inferior anterior breast shot. So we have everybody lift their breasts for this shot, and we're going to take the temperature findings of underneath the breasts. And this is also an abnormal finding. You can see these tiny little red circles. These are called focal hyperthermias, or tiny little areas where we test the temperature with our camera software. The difference in temperature is 2.39 degrees Celsius, and we're going to definitely ask her to make some lifestyle changes and figure out how she can reduce some of this inflammation and balance things out for her next scan. This was a case of inflammatory breast cancer that sometimes cannot be detected on mammograms. And for this patient, it was a very quick progression, and she didn't take action when she should have, unfortunately. So you can see this first scan that she did, I want to say this was February of, I think, 2012. This wasn't my patient, but a case study that we saw for educational purposes. You can see this yellow in her right breast, which is the left side of this image in the first slide over here. And then in the middle slide, I believe she came back in about May. I think she was recommended to get a 3-month follow-up. You can see how this yellow has increased to red. And so this is going in the wrong direction. This is not what we would want to see. Unfortunately, she did not want to take action quickly with surgery or traditional cancer treatments. And the natural treatments she was using were not working. It doesn't mean natural treatments won't work for someone else, but cancer doubles on average every 90 days. Some are very slow and they would never harm a person. They especially would never kill someone. And some, like this one, can be very fast. And so I'm pretty sure she came back in September over here. And at that point, she did decide to get a mastectomy. September of 2012, but then she passed away in January of 2013. Unfortunately, it was too late for her. So sometimes from one scan to the next, I see patients come in and they look something like this, and their report says come back in 3 months or come back in 6 months. And many patients say, you know what, I just want to finish this detox program before I come in to see you. And although we love it when patients work on their health and do detox programs, the follow-up isn't so that we see improvements. The follow-up is to make sure any of the original heat signatures in the first scan are not getting worse. Since cancer doubles on average every 90 days, that could be an indication that someone should take drastic measures and really figure out what is going on. But of course, as I mentioned before, it's always our hope that we have stable temperatures or improved temperatures, which usually means that patients took our advice or they took their advice of their doctors and worked on things like diet, exercise, de-stressing, getting better sleep, and detoxing, all of the above. This next slide is one of our extreme cases. This patient, she had refused chemotherapy and she came to see me in July of 2012. She knew she had cancer in that left breast, and you can see that this tumor, it grew really big. And unfortunately, she did have to get a mastectomy. She was trying a treatment that did not work for her. This was a very fast-growing tumor. Here's one of our testimonies from one of our patients saying that thermography has been life-changing, and I hear this all the time. People come in, seeing yourself thermographically is a very powerful visual to convince you that you need to make some adjustments with your lifestyle. So this patient said she's so glad she discovered thermography as a safe, accurate way to detect health issues early in the body, including inflammation and cancer. Had her first screening with me in November of 2016 and has been back for 6-month follow-ups ever since. She may have decided that on her own, or she may have been recommended. I don't recall with this patient. She said, I'm always very professional throughout the entire process, including the follow-up phone call. I've been extremely knowledgeable about achieving optimal health, and I highly recommend her. So that was very nice. Like to share those testimonies. We share them all the time on our Facebook page. You can search for Flow Well on Facebook or reach out to me, and I'm happy to guide you there. This is a before and after scan that improved. So this patient came in, the top 2 images were her baseline scan. And although these temperatures were within normal limits, this heat signature here, it's something that we don't want to see get worse. We absolutely want to see it get better. So it was probably toxic buildup or hormonal imbalance that she was able to have it dissipate at her follow-up scan. And she also decreased her delta T average number. So this one, we're comparing zone 1 and 2. The difference in temperature is 1.78. So threshold is 2 degrees Celsius. So it's still within normal limits, but that's absolutely my goal for her, is to get it to come down at her next scan. And she did. Went down to 1.30, and you can see above that left breast how much that heat signature reduced. This is a before and after scan. This patient, she does not have cancer, but she did not improve. So I would have harped on some lifestyle changes for her, or sent her back to her doctor to really talk about how she can detox her body and how she can get back to where she was and even get more improved from there. So you can see in her armpits here, you know, a little bit of red and yellow, and we talk about what can cause that in the phone report review. And you can see at her follow-up how that's increased. Now you can see a lot of white. White is the hottest color in this rainbow palette image, and then red and then yellow. And so that tells me she has a lot of toxic buildup in there. She might be, and also the breasts are actually too cold. The nipples are black now. They were magenta previously. So we talk about in the phone report review what might have caused that and how she can improve that for her next screening. Thermography is not just for the breasts. You know, here is a shot of the face and the feet, the legs. This patient, we didn't chop off her nose here in this rainbow palette image. It's black, it's really cold. It's actually the same color as the wall behind her. So that tells me she is lacking in circulation. Another extremely important thing that we check for in the face and the neck is any signs of oral inflammation. I would say this patient has mild oral inflammation. You can see these dark gray spots around her mouth. So definitely a little bit of room for improvement, but certainly not as extreme as I've seen many patients. We look for different vascular patterns in the ankles and the feet. This patient, both of the ankles to me look pretty inflamed, and then also the bottom of the right foot, more so than the left. So I would ask this patient, what are they wearing for shoes on a daily basis, you know, and we would do more troubleshooting at the review for them. The follow-up recommendation could be to see your own doctor, your primary care physician, or to get some body work done. And if that's the case, we typically will refer you if you don't have somebody that you go to for body work. Here's the thyroid screening that we do, and you can see in this patient that the lymphatic congestion improved. See all this yellow and the red in the mouth? That dissipated so much at the follow-up scan, as well as the thyroid is in the lower center of the neck, and the heat there has dissipated. So again, what we love to see. Here's an inverse grayscale palette of oral inflammation where you can see it starting from the mouth, leaking down the neck, and all the way down into that patient's right breast. Quite often there's a correlation with dental issues going on in the mouth and cancer throughout the entire body. If you don't know about the meridian channels of your body, it's a good idea to research those. And if you have anything going on with the teeth, we always encourage patients to go to a holistic biological dentist to really figure out how they can fix any infection in the mouth. And if they don't have any infection that is currently diagnosable, you know, what can they do to step up their oral health care routine to reduce inflammation in the mouth so it doesn't lead to issues that are really hard to take care of, like an abscessed tooth. Here's oral inflammation that improved. It's slight, but still an improvement. Even the circulation in this patient's nose improved. Here's another one that really improved, what we love to see. And you can see the inflammation, the red over the thyroid has decreased with that improved oral inflammation. If you have inflammation in the mouth, the first stop is the thyroid. So if you're on thyroid supplements because your thyroid's out of balance, or if you're on thyroid medication, you definitely want to evaluate, ideally with a holistic dentist, what is happening in the mouth. The back of the neck on this patient whose oral inflammation improved also decreased in heat. Here's another extreme case. This gentleman, he actually had a tumor on his neck. He had a squamous cell carcinoma, and he found a remedy that was eating away at the tumor. But unfortunately, it also started eating away at his carotid artery. This wasn't my patient, but I've never seen a patient who has a black forehead. So in your anatomy, you have your carotid arteries. I think this is one of the most important scans that we do. The blood supply comes up into the brain through veins that rest on the forehead. If one side of the forehead is colder than the other, it could possibly indicate carotid artery blockage on the corresponding side. So if that's the case, our interpreting doctors will let you know what they recommend. So hopefully you could avoid something like a stroke in the future. We scan kids, our patients' kids for free for our service. They pay a small fee for the interpreting doctor. This child, you could see his shoulders were out of alignment a little bit and the inflammation in the neck. And he did some chiropractic treatments, and now even the hips, the right hip looked higher here, and now things look level, the inflammation's gone. The thermography gave us some valuable information there. Abdominal inflammation, we have you check your liver, gallbladder, the colon, spleen, depends on where the inflammation is in the body. I've seen a few cases now of melanoma, which to the naked eye didn't look like a mole, but a little vein or dimpled skin. So thermography could identify if there's something on the skin that needs to be checked into further. The arms and the hands give us a lot of inflammation. If there's overuse syndrome on one hand, sometimes the fingers are too cold, telling us they lack in circulation. From the top of the head to the bottom of the feet, thermography is extremely beneficial. This patient ended up spraining his ankle shortly after these scans were done. And had he gone out and gotten body work done right away, he maybe could have avoided being out of commission for 3 days. So here's our thermography process for you. You know, you come into a private office or a private clinic room, and you have already filled out some forms for us. You stand in the room, the technician leaves the room, and you undress in the room and hang out for about 10 minutes undressed so that the clothing heat signature on your body can dissipate. And then we come back in and we do the imaging. And we're going to see that way in the imaging what your true heat signatures are and not something from warm clothing. After the images are done, we send them into interpretation, and the return around on the reports is about 1 to 2 weeks. We also have a stat service available. If you have a really pressing matter, we can jump the line for you. Like if someone just found a lump in their body and they have to get to a doctor's appointment, we can expedite these results in a couple business days. Always schedule a consult with your doctor once you get the report back. And your doctor is going to guide you, and then we go over the reports again with you for a second time. We basically want to make sure you get the most benefit out of your results, so we make sure all your questions were answered, or if not, we help you to formulate questions for your doctor, and of course we also discuss the follow-up at those phone report reviews. These are all of our services that we have available. I highly encourage the full body scan as your baseline. You never know what you can see in the full body scan, and you use your whole body every single day. So it is really good to get the analysis of the full body. There's also the health screening, which is the upper half of your body, front and back. With that scan, we get the face, thyroid, breast, or chest, abdomen, and back. So there's no extremities with that one, so you miss out on what's happening with the arms and the hands, the legs, and the feet. Then there's also one region of the body most popular is the breast scan. And as I mentioned, we scan our patients' kids for free. And please reach out to us. And the next page has how you can do that. This is my assistant Isabel's email, info@flowell.org. Reach out to us if you have any questions, or if you want to receive our ways to save on thermography email, we're happy to send that out to you as well. If you want to sign up today, we have a 24-hour special going on during this symposium that you get a $50 discount if you do sign up today. So email Isabel, let her know you want to sign up, and she'll be happy to schedule that for you on Monday. So I hope that everybody is going to move towards their optimal health and away from disease with thermography. And just keep in mind that if you do schedule today, it's a $50 discount on your next screening. We hope that you love your health and invest in yourself with thermography. We're actually giving away a free breast screening to one lucky winner today. So there's going to be a raffle before the end of this symposium. Keep listening and learn more about the raffle. All right, I hope you enjoy, everybody. Thank you very much. Have a great rest of your day.